My name is Brett Panter from the personal injury and medical malpractice law firm of Panter Sampedro. I am board certified by the Florida Bar to pursue civil cases, including medical negligence cases. There's something I want to talk to you about which happens more often than one would believe, and that's the remainder of items left inside patients after surgery. It's often referred to as retained surgical items, and you wouldn't believe the type of things that can be left in patients. The first item I want to talk about is URFO. And what does that stand for? It stands for Unintended Retention of Foreign Objects. And the next item is called RSI, which is retained surgical items. These are what we call never events. Anytime this happens, it's basically there is what something is called a presumption of negligence, meaning you're on the winning side of these cases, and really the issue is to determine what damages are caused by doctors and hospitals and nurses leaving objects inside a patient's body. Now, pilots have to use a checklist, and doctors in a surgical suite often use a checklist too. And the checklist is so to make sure nothing is forgotten. Just like if a pilot forgets to put his landing gear down, people can be injured and killed and the planes can be destroyed. The type of things that we have found over the years that remain in patients' bodies include, but is not limited to, needles, scalpels, drain tips, sponges, towels, forceps, guide wires, scissors, gloves, tubes and surgical masks, and even other types of things that you would not ever imagine. And these things do cause damage. Oftentimes, most always, the patient needs additional surgeries. There can be adhesions to the abdominal cavity if we're talking about surgical items left in the abdomen, which is often where they occur. These are significant problems that one encounters that you're not supposed to have occur, but it does happen, and it's always a result of negligence. We have handled many of these cases to the satisfaction of many clients. If you or your loved one suffers from a retained surgical object or item of any kind, feel free to call us and we can discuss with you how that action is to be brought under the Florida medical malpractice statutes. My name is Brett Panter, and I am from the law firm of Panter Sampedro.